Namaste, welcome back to our channel Ayurveda 360. After the third year BMS and in present days it is the fourth year BMS, students are usually confused regarding what to do during the internship. They see some of their batchmates holding the books of entrance exams and they also fall trapped to that. That is, they also start preparing. Now the question is whether you really require a post-graduation degree or not. Should you be concentrating on studying for the entrance exam or should you be concentrating on developing the clinical skills during the internship? So many students ask the questions regarding the relevance or the genuine need for carrying out post-graduation degree. So this video is for all the students who are having confusions in their mind. We have made certain questionnaire through which you can assess yourself whether you really require a post-graduation degree. So let us see what are those parameters which we have to consider for answering this question. I have classified these parameters under major 5 headlines. One of them is, the first one is the interest, the genuine interest by a student. Whether he or she really wants to study further. Is he or she psychologically prepared for studying for another 3 years? Because after completing the BMS, usually the students will be around the age of 23, 24, 25. So is it possible for them to concentrate as a student until the 28 years of age? So that is the first point, the genuine interest of the student to study the post-graduation. The second point is in relation to the specialization. Some of the students may have their parents being already doctors and practicing certain particular branch. Maybe they have already a setup of a surgery, or you can say a OBG practice, or they already have set up in relation to Panchakarma, or they might have already decided the place and where they are going to practice, the need depending on the area, and they have already decided that I am going to do a post-graduation in this particular branch, maybe a pediatrician, something like that. So this is important. So the specialization with a particular or strong reason is the second point. The third point is in relation to the entry to academic field. This is very important in present times. An academic field requires post-graduation degree. A BMS student cannot go to any college and start teaching the students. That is obvious. So, if you are really interested in joining the academics and further maybe in the administrative field in various institutions, you definitely require post-graduation. So, the third point was if you are interested in academics or not. The fourth point is in relation to the financial benefit along with the degree. In medical field, you have the opportunity to earn in the form of stipend, also get the degree. This is possible only if you join government colleges, may it be national level or the state level. Depending on the states and national level institutes, the stipend may vary, but of course, some or the other amount will be credited to the student's account. At the same time, he is going to get the post-graduation degree when he or she completes 3 years of post-graduation. So it's a dual benefit. So whether you require the capital so that you can establish a clinic later, or you already have a financial capital ready with you, like your parents have already saved for your, already set up related to the clinic, or you do require certain savings. So that is the fourth point in relation to the financial benefit along with the degree. And the fifth point is if after BMS degree you are not confident of doing anything. This happens with most of the students. They are not sure of what to do after going out of the college campus, that is the BMS college campus. So if they are in that state of mind, not confident of opening any clinic, not confident of entering any particular, you can say, field related to medicine, preparation of medicine, or maybe collection of drugs. So not really knowing what to do after BMS. So such confused status will also be a parameter. So in this way, we are going to see each and every parameter and certain options like the questionnaire along with the options and the scoreboard, or you can say the points table. Each question will have 4 different options, the highest point being 3, second being second, that is 2, third being 1, and fourth being 0. So least is 0 and the highest is 3. So in this way, we are going to assess each and every parameter, and ultimately at the end of this, you can say discussion, or you can say the quiz type of video, you will be having your points out of 15. Maximum being 3 into 5, minimum being 0 into 5, that is 0. So you will have anywhere between 0 to 15. At the end of the video, I will tell my opinion regarding how much should be focused regarding the preparation of entrance. So the first point what we saw was the genuine interest of the student. So now you can answer yourself based on the points here. If you are genuinely interested and it is not by the force of any other person, maybe a parent, maybe a relative, maybe a friend or anyone. If it is your own choice, you can give 3 points. If it is by the force of the other person, any other person, you can give 2 points. Or sometimes students will have interest in higher studies, but they are not sure why they are doing. So if you are not having any particular aim, but still want to pursue because of your interest, you can give 1 point. And ultimately, if you are not at all interested in higher studies, you can give, that is 0. So I think by now you might have written your points according to this question. So let's move on to the second parameter, that is in relation to the specialization. So now if you are particular about a subject in which you want to do specialization, and you will do the post graduation only if you get in that particular field, you can give 3 points. That is, your wish as well as the subject obtained are the same. If you are getting post graduation seat but the subject is different, you planned something but you got something else. But if you are able to manage that branch, it may be related to your own thought earlier. If you are able to manage that, can give 2 points. So your wish but got different seat, you can manage, no problem, I am able to take 2 points. You want to do post graduation like specialization, but only for the purpose of putting MD in front of BMS when you set up a clinic. Just to show to the patients that you are a postgraduate, you are a specialized person. You can give 1 point for that. And if at all you are not at all interested in the specialization concept, give 0. So again, you might have given the points by now. So let's move on to the next parameter, that is in relation to the academic interest. So this is very important in present days, because the academics is the one which is going to mold a huge number of students. If you are doing clinical practice, you alone are able to manage few patients or many patients. So it may not create that much problem if you are not really doing that properly. But if you are entering the academic field, you are influencing a huge number of students every year. That is why this is very much important. You are being a role model to many of your students. So the first point here is, you want to enter the academic field, that is necessary, and you know that you have that capability, the skills, what is required to be an academician, so that the students get inspired by you. Like students get inspired by your way of presentation. So then you can give 3 points, that is the highest. You want to enter the academic field, like you want to teach students or enter into administrative field, but if you are not aware of your skills, if you are not sure, sometimes you might have been called by your teacher to give a presentation and you are trembling, you are in fear, you are not sure whether you are convincing the students or not. So in that case, if you are not sure of the skills, you can give 2 points. And there are few people who don't want to open a clinic, but they want to secure certain amount as a salary every month. Maybe by joining a college, they want to get certain amount, fixed amount through, you can say, salary. So in that case, you can give just 1 point. You cannot do the post-graduation just because you don't want to open the clinic. That is one of the worst decision what you can make. It may help you in getting some money, but ultimately the students will not get inspired. So this is very important. Unless you open a clinic, if you are planning academic related post-graduation, then I would just give it 1 point. Not 0, of course, because you are having the knowledge, but it is just 1 point. And the last one, as usual, so if you are not at all interested in the academic field, you can just put 0 in front of that. So by now, your third parameter is also like marked with specific points. We will move on to the next one. That is, I think most of the students are interested in this, related to stipend. Related to the stipend and degree. It's like a double joy. You are getting the degree at the end of 3 years, and at the same time, throughout these 3 years, you are getting a particular amount of money every month credited to your account. So which college has how much amount of stipend and all those things? The updated versions, I'll be making a video on that very soon. So in that video, I'll be explaining regarding the amount of stipend each college or each institution is providing in India. So the highest points in this category is you want to like get the stipend and you want to save it for the capital. You want to save the capital for maybe future purpose, and you want to do it in the national institutes or state government related institutions. If you are really in need of that capital, soon after BMS, if you are not able to invest and if you don't want to take loans and burden yourself, then this is the best option. You can give yourself 3 points if this is the ultimate cause. You can give 2 points if you are interested in a stipend seat, but basically you do not require any financial assessment, like financial assistance. You already have some backup amount through which you can open the clinic, but still if you are getting the seat of a stipend seat, so you are taking that. So in that case you can give 2 points. After that, there are few students who want to take a college which is nearby their home, and even if it pays a minimum amount, they are ready to take. Just because it is just nearby their home, they don't want to stay in hostel, and they want to take they want to up and down from that place, like from their hometown. So in that case, you can give 1 point. You are staying with the family and not spending too much on the outside expenses. So in that case, yes, you can give 1 point, even if it is a non-stipend receipt. And last one, as usual, if you are not at all requiring stipend and neither you are worried about post-graduation, you can give 0. So this was the fourth parameter. So now the last one, that is in relation to if you are not sure what to do after BMS. Many times it happens. Many students who just get deviated from first BMS until the end of internship. At the last month, at the end of their BMS career, they are the ones who are highly stressed because they are not sure what they are going to do after 1 month, and their parents and relatives are all ready to take their son or their relative as a doctor. They are ready to receive, and the society is also looking at that person as a doctor. So that is the most stressful time in a person's career if he is not or she is not sure of what to do after BMS. In this case, students want some more time. They will expect I do take PG, then 3 more years I am going to get, so that I get certain idea of what to do later. So this reason is genuine. So let's see how the points can be given for this. If you are not at all ready to open a clinic, if you are not at all interested in taking certain parallel subjects like opening a pharmacy or in relation to the collection of drugs, supplying of drugs, genuine drugs and all those things, you require definite guidance. You can give yourself 3 points. That is the highest points in this case. You can give 2 points to yourself if you are not sure of what to do and you are interested in a particular field like a pharmacy or drugs. This is a very important aspect of Ayurveda. If you are not planning to open clinic, at least you can supply the best quality medicines to your friends and the other colleagues. So in that way you are serving Ayurveda. So that is your aim. You can prepare and you can give your 2 points, and once you get the degree, that is in the subject of Dravya Guna or Rasashastra, such subjects you can choose so that you don't have to worry about clinical practice. But definitely you are in the field of Ayurveda. And you can give yourself 1 point if you are not sure of what to do now, but you are not confident of getting the knowledge even after BMS, after PG, sorry. So some students are there. I'm not sure if I'm going to get knowledge after PG. So that means from the beginning itself, they are having negative mindset. So even if they get a degree, even if they are going to get a good college, they may not have that psychological skill to adapt to the situation to complete the BMS or PG, post-graduation. So in that case, you can give 1 point. And last point, if you're not at all interested to be in the field of Ayurveda, especially happens with, I am not going to tell anyone anything, but I think you have understood. Some of them leave the course as such. After BMS, they are doing some other work. Some of them are businessmen, some of them are working under someone else after certain other degree. So these kinds of students are also there, and it is common for every field. Each and every person of that field will not remain in that field. That is obvious. Since they have already entered the course, they want to finish that. That's why they have finished. And when they are sure they are not going to remain in this field, so definitely don't take the risk of post-graduation entrance. Give yourself 0 point in this. So by now, some of you might have got 15 points. That is the highest of all, 3 into 5. Some of you might have got, you can say, 14 points. Some of you might have got 12 points. So how to differentiate? In my view, if you are getting anywhere above 10, so that should be the important cause for you to prepare for postgraduate entrance. So in that case, plan your internship in such a way that you divide the time between the hospital and clinical skills, that is development of clinical skills, and then the post-graduation entrance related study. Don't put 24 hours for exclusively entrance. You are not going to succeed, not possible. And at the same time, you are not going to get the clinical skills. So keep the time and fix your goals, plan accordingly, you will succeed. Above 10, you definitely need to prepare. And if you are anywhere between 7 to 9, 7, 8, 9, then you are somewhere neither here nor there. So in that case, what you can do is concentrate on your strength, concentrate on the internship, clinical skills, develop that. At the same time, prepare some time regarding entrance, and after giving the entrance exam, decide what to do. So that will be the best method, because if you are having the clinical skills, then definitely you can have a backup plan if you are not succeeding in entrance. So that backup plan is necessary. You should be confident after internship. So plan in that way if you are getting anywhere between 7, 8 or 9. About 10, absolutely necessary. 7, 8 or 9, do the internship with full interest. After entrance exam, decide what to do. That will be the best option. Decide after getting the results. And if you are getting anywhere between 1 to 5 or 6, definitely you should not try for postgraduate entrance. Mostly the ones who are coming under this category are who are not at all going to stay in the field of Ayurveda. They want to just get the degree of MD just to get the social status, or they are not sure of why they are doing PG, or they are not getting any government seats and they are just paying the private college to get the degree, just taking their parents' money. And sometimes the PG what they are doing and the real life practice what they are doing, they are entirely different. So usually those people are coming under this category who are getting 1 to or 0 to 6 points. So if you are getting that, I would suggest you to put your full internship into the efforts of getting complete clinical knowledge. That is the best method of how you can even overtake a postgraduate person. The one who has MD or MS degree even may be behind you in clinical practice. You will have 3 years of time to establish your clinic, and by the time your friend is out from MD or MS, you would have already 100 to 200 patients waiting in your clinic. So that is the real, you can say, the Ayurveda practice you can do there after BMS. You need not worry about the social status. If you are treating the patient very well, even 1 patient per day, at the end of 2 or 3 years, you will have at least 50 to 100 patients per day. That is guaranteed. So this was the video for today. I think most of the students who had confusions regarding whether to choose or not the post-graduation study, because choosing this will decide your internship fate. If you are choosing yes, then your internship study should be balanced. If not, then you are neither having clinical skills nor ready to take the entrance. That should not happen. For that purpose, I have made this special video. And myself, Dr. NANDEESH J. If you like the content, kindly like, share and subscribe to our channel. Please ask other Ayurveda loving people, colleagues and the common public to watch our videos. If they like, kindly ask them to share these videos. Until next time, myself Dr. NANDEESH J. Thank you.